Thank you very much for having me. My name is Jonathan Fields, and this is a systematic review of Electro Acupuncture for diabetic peripheral neuropathy and a proposed standardized protocol that we came up with based on the research. So before we begin, we'll do some acknowledgments, and I want to acknowledge all the professors here at ADAM for the help on the project. I think at some point I had spoken to everybody, and everybody gave me some valuable input on it. I had the concept for the project actually 3 days before I even started the doctoral program. Illy, my wife, and I were in China, and we were coming back, and I got the idea of doing this, and I actually wrote up a whole protocol that obviously changed over time based on the research. And I think the scope of the project changed a lot as well based on some of the conversations I had with the professors. So I want to thank them for helping me with that, and Dr. Francesco Amico and Joshua Park for helping me doing some of the editing on the project as well. Okay, so we're going to get into the abstract. So once again, diabetic neuropathy could damage some of the nerves. It's a common complication of diabetes, and it disrupts sensory, autonomic, and motor neurotransmission. Right? And the drugs do offer some very limited relief, but the acupuncture studies have actually shown that it does help manage the pain in both animal and human models. So there's a greater potential for electroacupuncture over manual acupuncture because we can control the frequency and the duration of the stimulation and all that kind of stuff. So Dr. Foodie, this is just a short methods. I have a full methods later. So we looked at electroacupuncture studies in adults that were diagnosed with type 2 diabetes, and we used the Medline and Web of Science databases. Out of all the studies, we picked 12 articles. 10 of them were animal, and 2 of them were human participants, right? And there's a couple of devices. And a quick overview of the results. It showed that there was actually significant reduction in pain and improved neurotransmission from electroacupuncture in both types of studies. So positive results, good thing. And as well as the reduction in pain, it also showed that there's reduced inflammation, reduced cell death, and reduced blood sugar levels. So these were other biomarkers that we were able to track besides just the subjective pain levels of the patients. And here's a quick overview of the conclusions. So there was some pretty well conducted preclinical and clinical research studies that showed that electroacupuncture did alleviate the pain and induce changes in improved circulation, the plasma glucose levels, inflammation, apoptosis, which is the cell death, programmed cell death, and enhanced neurotransmission, the nerve signaling as well. But we only had 12 studies, only 2 of them were human, so we do need further research in the field to confirm these results and go on larger scale clinical trials. So a little bit of an introduction. It's a pretty common condition, the diabetic peripheral neuropathy in diabetes. It affects the sensory, which is the feeling and the heat sensations, thermal sensations, autonomic, which can actually affect internal organs as well, and motor neurotransmission, so actual function of arms and legs as well. It can affect up to 50% of people with diabetes, and 16 to 26% of them actually get pain from it as well. 7% of them get ulcerations, which can lead to amputation in 10 years. And I'm sorry for the graphic photo, but this is what some of this stuff can look like, and the whole foot can actually get gangrene, and that's why it leads to amputations. And this is one of the reasons why I wanted to work on this. It is a pretty serious complication with serious consequences for patients. And I think as far as a lot of you all know, if it's not addressed quickly and at the beginning, the longer it goes on, the more difficult it becomes to treat. So typical treatments right now are just drugs prescribed for the pain: gabapentin, pregabalin, duloxetine, and metformin to control blood sugar levels. Right? So occasionally the patients will be told to use a TENS unit at home, and there is some research on that. And a lot of times the doctors just tell them, sorry, you can't do anything about it, suck it up, right? If the drugs don't work, you're on your own. And so if electroacupuncture could actually reverse the degenerative process and help regenerate the nerves, this would be a huge advancement over the conventional therapies that are available to patients right now. And this is a pretty basic, cheap TENS device. You can get these things for about $30 on Amazon. So if you're treating neuropathic pain, you can always recommend to patients get one of these as well. I do it with my patients. They'll appreciate it to know that there is something they can do. It won't take your place. Don't worry. It's not going to get the same effects as electroacupuncture or acupuncture and the other modalities that we have to offer our patients. This is what brought me to want to work on this, because diabetes is such a huge problem in the world. It's one of the biggest challenges to the whole world in the 21st century. It's been declared a global epidemic by the WHO. 8.5% of adults in the world were diagnosed in 2014. That number's higher now, 422 million. So that's pretty much the whole United States. Everybody's got diabetes. Now, that's worldwide. And they're predicting that number is going to go up to 600 million by 2035. And it'll be the 7th leading cause of death by 2030. The biggest problem, one of the reasons I wanted to work on it, is the economical impact of what it's doing to our hospitals and the cost of care. It is just insane, right? 12% of all global health expenses in the whole world went to diabetic care, and that was 2010, right? So that's estimated at close to $400 billion annually, and that's going to rise to almost $1 trillion by 2030. So huge costs every year. A little bit about the pathophysiology of it. Right, so it's mostly driven by insulin resistance and lifestyle factors, right? So smoking, poor diet, and lack of exercise, lack of movement. We live very sedentary lifestyles, working on computers or being on the couch, you know, Netflix and chilling all day, right? So the hypoglycemia can actually damage blood vessels and the nerves. It starts as paresthesia, so that's numbness, tingling, burning in the hands and legs. Usually that's the beginning. If autonomic nerves are damaged, it can damage the internal organs as well. And then there's other metabolic factors like high cholesterol that might actually block up some of the circulation, which will make it more difficult for the nerves and the blood vessels to work. And there are a lot of genetic factors that we still don't know about and we're still learning about that may make patients more susceptible to these kinds of injuries. The biochemical mechanisms. So this is a little pointer of hyperglycemia, and you can see the white bars are the glucose, and it's actually crowding the blood vessels. So eventually it'll change the shape of the blood vessels. They'll get crowded out, and it'll disrupt other metabolic pathways within the blood vessels and the nerves. It causes oxidative stress and inflammation. You build up these toxins, these toxic byproducts in the system that you can't release. There's depletion of essential coenzymes. And I'm not going to get into all this stuff. Some of this stuff is very technical, so I have it all in my presentation in the capstone, but we're going to leave out some of the super high-tech knowledge here in the presentation. So causing more inflammation, causing issues with the blood vessels not being able to repair and grow, and causing damage and programmed cell death of the nerves. Right, so these are just some of the enzymes that become elevated from hypoglycemia. The PKC is one that leads to the vascular alterations. It can actually change the permeability of the blood vessels and the nerves. Nerve growth factor is downregulated, so then once the nerves are damaged by the hypoglycemia, they cannot rebuild themselves. They can't heal. They just get worse and worse. Oxidation and inflammation is measured by, these are some of the biomarkers, and you'll see more later on. And this is what I mean. So you see these are some of the proteins that are damaged and some of the inflammation markers that we can track. So what happens is the whole nervous system, the sympathetic nervous system, that's your fight or flight, right, your adrenaline, kind of just goes out of whack. And then that creates a problem in how your body experiences and deals with pain signals. It dysregulates the opioid system, your endorphins, messes up the tolerance. These are a couple of different endorphins, and you'll see them used in some of the text later. But it's these neuropeptides and these endorphins is what actually creates an analgesic effect when you have pain. And your body does it automatically, right? If you get an injury, you get a cut, this healing cascade begins in the same way we use acupuncture to heal. But when you have hyperglycemia and these other issues, it inhibits the endorphins, and then you get this neuropathic pain that will not go away. It just gets worse and worse. And that's the chemical structure of some of the endorphins. So symptoms and differential diagnosis. This is from the biomedical Western side. There's focal or mononeuropathy, usually just a single nerve. It starts with paresthesia in a couple areas of the body. There's polyneuropathy, which can affect motor and sensory nerves, and can affect the hands, the feet, the eyes, the digestive system, right? Gastroparesis is a problem. People lose the ability to have motility in the stomach because the nerves are affected. We have ED in men, or the excessive urination, and some of these other issues that can happen with the autonomic nerves. And you become at increased risk for falls, because if you can't feel where your feet are, and you're losing motor ability, you're much more likely to fall, and that's when we'll see some diabetic patients, right? And they start off with the walkers or the canes, and eventually end up in wheelchairs and possibly amputations and the rest of the stuff, right? That's there goes the wounds, the ulcers in the feet. They can go gangrene. They can require amputation, and that is the leading cause of amputations in the United States is diabetic neuropathy. So it is a serious problem. And autonomic neuropathy, so this is what we just talked about, some of the internal stuff going on, as well as the sweat glands. So pretty much cardiovascular, so your heart, your digestive system, your genital system, and sweat glands, they can all be affected by neuropathy. Proximal neuropathy is rarest, and it can include these areas, but it will actually cause muscle weakness and atrophy as well, right? And weight loss. And drop foot or foot drop. So that's when the perineal nerve becomes damaged and the foot just kind of hangs there, and then it's very difficult to walk and it's very difficult to treat and heal. I've had some success with patients on it, but it's minimal depending on how long the damage has been done. Right? So the biomedical diagnosis is usually done based on the patient's history. We do a physical examination, right? We have the little brushes and the needles, so you can kind of poke around, see where they have feeling, what type of sensitivity they have. There's lab tests. We can check their HbA1c, their glucose levels. Some of these other biomarkers can be tested. And there's the nerve conduction and EMG studies to test nerve and muscle function, respectively, and biopsies. So this is a sample of EMG or one of the nerve conduction studies. And basically what they're looking for is they're testing between different areas, and they're looking for the velocity and the latency in the nerves to see how well the neurotransmission is between point A and point B. And they'll go all up and down the legs or wherever they need to. This is also used for carpal tunnel and whether you might have a neck injury or a spine injury. They also do this kind of testing as well. So the biomedical treatment of DPN, controlling the blood sugar, diet, lifestyle, and medication, right? So as you know, a lot of patients won't change diets, some will. Some don't understand how serious it is, and sometimes the addiction to the sugars and carbs is just too deep, where they just kind of let it go out of control. Lifestyle, once again, lack of exercise is probably the biggest part. If you don't have circulation, nothing's going to work, you're not going to heal, the nerves aren't going to get any better. Than medication. So managing some risk factors, smoking, hypertension, cholesterol, obviously all these will just add to different comorbidities and will further damage and impede your circulation. Right? Managing pain, there's the pharmacological and the non-pharma options. We're going to go over those again. And just monitoring the feet, looking out for ulcers, make sure they don't get infected, make sure you're not falling, and paying attention to when the neuropathy starts kicking in. Right? So non-pharma options are the TENS, and that works via the gait control theory, which is a theory, but it is pretty widely accepted that the spinal column basically is the sensory nerves and motor nerves and everything. So if you stimulate the spinal nerves with a non-painful stimuli, that can basically block painful stimulus that the nerves are currently sending. So that's just part of that theory. And Electro Acupuncture possibly works along those same guidelines as well, and just regular acupuncture. Intermittent pneumatic compression. That's those, I'll show a picture of that in a minute, but that's the pumps that squeeze the legs. They use them in the hospitals so you don't get blood clotting and things like that. And there's some good research showing that those are helpful as well. And vitamin B12, because it can help protect the nerves and regenerate some of the nerves. Personally, I like to use B complexes for both the injections and the orally with the patients, because B1 and B6 have some other very important neuroregenerative properties. B1 helps give the nerves energy. It helps strengthen the nerves. B6 can actually help with pain and helps improve neurotransmission. So don't limit yourself to just B12. And if you are using B vitamins with your patients, please use methylated vitamins. Cyanocobalamin is the cheapest, worst form of it, and the body has to work to convert it into methyl. And some patients have trouble with converting it into the methylated form. So you're going to get much better clinical results. It's worth the extra couple bucks to use methylated, coenzymated vitamins if you get the chance. Pharmacological, like we talked about, gabapentin is actually for an anticonvulsant. So it's used in seizures, for epilepsy, and postherpetic neuralgia, which is shingles, right? Pain after the shingles disappear, but sometimes patients could have pain for sometimes years afterwards. Pregabalin or Lyrica is the name that's sold under. Pretty much the same thing, and they also prescribe it for fibromyalgia. Duloxetine or Cymbalta is a SSNRI. They use it for anxiety, depression, and fibromyalgia. So none of these are actually made for diabetic neuropathy, but they're used for it. Unfortunately, none of these actually reverse the damage or help prevent further damage. All they do is help manage the pain. And if you've treated patients with neuropathy, I'm sure you all know that the drugs don't really work. They might mask it a little bit, but every single patient I've ever had come in, and they're usually on a combination of these drugs, they still have the pain. They're still coming to us. It's not solving the problem. Right? So they had one systemic review of pregabalin and actually concluded some people will get substantial benefit, more will have moderate benefit, and many will have zero benefit or discontinue. So that tells you about the efficacy of these drugs. And this is what happens, right? Patients end up and they're taking 3, 4 different medications, and they still have the problem. The nerves are not getting any better. They're waking up at night with burning limbs, and they're having trouble walking, and so on and so on. So there are a couple new things under development. There's been some recent new discoveries, some pharmaceutical compounds, these different cytokines that help with inflammation that they just discovered. The HIF1A is shown to have a neuroprotective effect, but it's, it'll be years before these drugs come to market, and who knows if they'll work. They've tried injecting NGF into people directly or administering it through IV, but they had a bunch of unwanted side effects in the trials. So while it was a good theory, it just didn't work out clinically. Man, that's just some of the side effects. And so to summarize, out of all those therapies, there's only 2 drugs that are actually approved by the FDA, by pregabalin and duloxetine, and they don't offer full relief from pain. Usually patients will be on both, and they still have the pain, and both of them can have some severe side effects, right? On the other hand, studies have actually shown that exercise, B vitamins, herbal medicine, moxa, and acupuncture have all shown to have benefits. We do need more research on it, but so far it looks pretty good. So electro acupuncture may improve the outcome and offer greater opportunity to standardize, like we talked about before, because you can control the frequency of the stimulation, the exact frequencies you want, or alternating frequencies. You can control how long they're getting stimulation rather than manually, and you can do, depending on your device, a dozen points at a time rather than sitting there and maybe 2 hands at a time. Right? I know in the clinic we're busy, we're seeing multiple patients, so it's a lot easier to leave somebody with 30 minutes having the machine run and stimulate 12 points at exactly the frequency you want. So, and the evidence shows that the different frequency ranges exert different effects on pain and release different neuropeptides and different pain mediators depending on what the frequency is. Generally low frequency, most of the studies are actually based on low frequency. 2 to 15 hertz may induce serotonergic effects and non-adrenergic analgesia. Suggesting that this can affect the descending pain inhibitory system, which we'll review in just a minute or so. Right? Well, actually, this is it. So the pain starts right at the receptors, goes through the nerves, up through the dorsal root ganglion, through the dorsal horn, and then eventually up through the spinal cord, right, and up to the brain. So the hypothesis or the theory is that you're interrupting it somewhere along that way, and the opioids and endorphins that the brain makes on its own help inhibit the pain along that pathway. Right? And that's actually what serotonin looks like. That's the molecule there. So the effects have been shown to release a couple of these different endorphins and even modulate the immune system as well. Right? And then on the other side, you got the high frequency, 100 hertz or over. And that releases different segmental spinal opioids, so just a wide range of them, as well as GABA and glycine, which suggests it's got a little bit more of a mitigation for acute pain. So as of right now, it looks like possibly the low frequency is better for chronic pain, and the high frequencies might be better for acute pain, and maybe that's sometimes why we use both or alternate, so you can kind of address all these things and release as many of the different endorphins and some of these different processes as we can, right? But we do need more research to establish those protocols. We don't know 100%. So there's been fMRI studies in humans and actually shown that the effects are dependent on the acupoints. So different points can help release different endorphins and are more viable, right? And they've done similar studies in animals as well, and they've shown it does help increase the pain threshold. But selecting which points are actually clinically relevant based on the research is going to be one of the challenges in the future doing these studies, and that's one of the things we worked on in this review. So there's a growing amount of studies, there's a lot of evidence out there, but we need to summarize the best and most well-conducted research, because not all the research is great, and we need to be able to have those outcomes to inform clinicians and patients what to expect through these kinds of treatments, whether insurance companies will reimburse for this kind of stuff in the future. Some do, some don't, and that's kind of the object of my review, is to summarize all this and figure out which frequencies and which points are most effective for diabetic neuropathy based on the research, as well as taking into mind some of these confounding factors like the medication and other interventions that may help as well. Right? So treatment in traditional Chinese medicine. Right? So we've known about diabetes, as was mentioned all the way back in the Neijing, right, over 2,000 years ago, as xiaoke, or wasting thirst. It was recorded in the Neijing, and they listed it there as caused by overconsumption of sweetie and fatty foods. So this is not a new thing, we know. And the foods have only gotten sweeter and richer and more addictive and greasier and fatter than they ever were before, and that's why this problem, while back then it might have been pretty rare, it's a very common problem now, right? In later texts, they actually describe the excessive thirst, the excessive urination, and the excessive hunger. And then later on, and that obviously is diabetes, right? So we can, there's an equivalence there. During the Ming and Qing dynasties, they actually described the peripheral neuropathy that was associated with the xiaoke as numbness and cold, pain of the hands and feet as a complication. So no questions. That's what they're talking about, diabetic neuropathy, right? The patients are consuming the sweet and fatty foods, excessive hunger, excessive thirst, excessive urination, and neuropathy. Right? So pathophysiology of diabetes and the neuropathy in traditional Chinese medicine. We know modern texts kind of tell us it's a combination of both excess and deficiency. Right? Usually spleen Qi deficiency, stomach yin deficiency, kidney yin deficiency. That's kind of what we see in some of the earlier stages, and then it progresses into neuropathy and into more serious disease as it goes. Right? Later on, it'll develop into some dampness from the spleen Qi deficiency, some maybe empty heat, and some blood stasis, right? So the common Zangfu organs affected, spleen, stomach, liver, kidneys. Eventually that will spread to anything like we talked about, autonomic and affect even cardiovascular. And the diabetic neuropathy is from the progression of this process, right? It starts with the deficiency of qi and yin, turns to empty heat, that makes phlegm, eventually you'll get yang deficiency as well, and blood stasis. So here we go. So the foods in high sugar and fat, they lead to the qi and the yin deficiency of the spleen and the stomach. Right? So we see the tongue here, the coating's kind of thick, we got the teeth marks. So very classic qi and yin deficiency. Well, it's actually not showing that much yin deficiency yet, more dampness, right? So that's internal dampness, blocking the channels and sinews. Long-term deficiency creates the empty heat. That increases the blood viscosity, leads to blood stasis. The blood gets so thick it can't flow anymore, right? Then the empty heat interacts with the damp, it congeals into phlegm. From there, the blood, the phlegm and the blood stasis just create more obstruction. It's just very difficult for blood and for nerve conduction to flow because everything's obstructed. That then leads to malnourishment of the tissues because you're not getting blood and oxygen to these different tissues, so they get more damage, right? Leads to deficiency of liver and kidney, and that causes vascular coagulation, decreased flow of qi and blood to the extremities. Just nothing is moving. It's a serious issue, and that's why the feet go gangrene and get ulcers, because the nerves and the blood vessels in the extremities are just not getting any nourishment. So they're not getting tonified, they're not getting nourished, and they just become more and more deficient and start burning up from empty heat. Right? So these are some of the patterns. Obviously, within TCM, there's many more patterns, and every person in here might have a different pattern. But these are the basic ones we picked based on some of the research that was out there. Liver and stomach stagnant heat, phlegm and heat stasis, dual deficiency of yin and qi, that's the most common one that we start with, and deficiency of the liver and kidneys, right? And once it progresses into the neuropathy, we're looking at phlegm and blood stasis blocking the channels, deficiency of yin with blood stasis, deficiency of yang with blood stasis, and deficiency of yin turning into wind as well. So some of the herbal strategies used to treat this, right? So dispelling phlegm, invigorating the blood, nourishing yin, moving blood stasis, warming yang, moving blood, nourishing yin, and extinguishing wind. And the acupuncture is pretty much the same. We're kind of going after those same strategies. So we're using points that achieve these issues, right? So maybe bladder 18, course and soothe the liver, bladder 20, tonify and nourish the spleen, 23 for yin and yang of the kidneys, right? And combine the local points like the Baflung and the Bashia points just to get blood flow directly to the extremities. So here's the methods. Dr. Foodie, I hope you're paying attention, right? It's for you. So we're searching Medline and Web of Science databases again for only English article terms, right, with these terms in there. So they had to have these terms, both diabetic neuropathy and electro acupuncture, no date restrictions, and we wanted to include adults with it, okay? So we excluded all the reviews, we excluded books, we excluded conference notes, editorial stuff, and articles and anything other than English, because we just didn't have availability for translation. And if both electroacupuncture and diabetes was not mentioned in the abstract, we took that out as well. The search was done on July 27th. There was 35 results from Medline, 42 results from the Web of Science database. Prisma is a scientific method of picking like the best quality articles. There's a 27 checkpoint process. And after we went through all that, we removed all the duplicates and everything that kind of didn't meet our criteria of high quality research. And we were left with 12 articles. There was actually 13, but one of them wasn't open access. I emailed the author, they didn't get back to us, so we weren't able to use that article, right? And what we analyzed, specifying specifically what we were looking for, was biomarkers that were affected and could be tracked. Not just, hey, does the patient feel better or not? What biomarkers can we see? What can we justify to MDs or to Congress in the future, or whatever it is, to show that this is not just subjective. People are getting better, and we can track this. What acupoints were used, what frequencies were used, the dosage, the time, the duration of the treatments, and out of all these, the acupoints, the frequencies, and the dosage, what was used the most often, and which are the actual most effective out of all the studies. So the results are in the animal studies, right? They actually induce diabetes by injecting them with this toxin that it's actually a chemotherapy agent that causes hypoglycemia. It's used to treat pancreatic cancer and will affect the pancreas. So it causes biochemical and physiological changes, and we were able to track those biomarkers with the electroacupuncture. And this suggests that there is beneficial effects from electroacupuncture on the neuropathy. And we summarize this in Table 1 with the protocols and the points, which we'll see in just a few minutes, right? This was a study on the different types of proteins, and it actually showed, this is from the first study, there was an increase in the pain threshold, there was a decrease in blood sugar levels, and the oxidative stress injuries, and it helped actually regulate those injuries and reduce inflammation in the spinal dorsal horn. And this was in the rats, right? It reduced thermal hyperalgesia, so that's an oversensitivity to heat and cold, right? I think everybody's experienced when they're working with patients, oh, my feet get freezing cold at night, and that's one of the symptoms, right? It actually helped regulate nerve growth factor, and some of these other markers that are, once again, they're in my capstone, but I'm not going to go into the technicalities of each one of these different biomarkers, because we'll be here all night, and I think everybody wants to go home at some point. So there was another study that showed after a 3-week protocol, it actually decreased NGF, right, and it helped normalize the NGF. So sometimes what will happen is, even though you want nerve growth factor, sometimes when it gets to a certain stage, a later stage of the neuropathy, it just starts kind of going out of control, and it'll produce too much or too little, and you just really need to modulate it and regulate it. So it's not always about increasing it. Like we said, they had the one study where they tried to administer it IV, and it created unwanted side effects. So here's a couple other biomarkers that showed it helped reduce the inflammation and regulate the immune system as well. Okay. So later research, it showed that it helped reduce allodynia, and this is just a hypersensitivity to touch. I'm sure you've had patients that, they'll tell you, even my socks, I can't wear socks because it is so painful, and that's basically a description of allodynia. So it showed that in the rat studies, it actually helped with that as well. And that suggested that it actually did help with inflammation, and that's the hydrogen sulfide mediated pain receptors. And it also showed that we can help release nitric oxide, right? So the nitric oxide, you see sometimes these blood vessels, they get clogged up or they start to thicken or get smaller, and nitric oxide will actually open up the blood vessels and allow more flow to get in there, which can help heal the nerves and help nourish the area in the extremities so they can begin to heal, right? So it also helps with some of the cold and thermal pain as well, right? They had other evidence suggesting that it also helped reduce the programmed cell death in rats with the diabetes, so it slowed down the nerve cells from dying. And there's another recent study that found by regulating, downregulating these particular proteins, it reduced the cell death again in the sciatic nerve, right? So, and we know that runs from the back all the way down into the feet, right? So that could show that it might actually help with the skeletal muscle morphology, improvement of limbs, reduce cell death, and we have biomarkers now that we can actually track it. So we can see that what's going on. This is a small diagram of cells, right? So this is a healthy cell, and then as they start to die, this is them dying from the inside, and this is them getting deformed and dying and breaking down from the outside. So, boom, healthy cell, cell dying. Yes. All right. More recently, another study showed that 2 Hertz protocol reduced the paw withdrawal time, basically how long it took them to remove their paws from something that was causing them pain. And we had a couple of these other markers that just showed, here's one that they actually used intraperitoneal injection to activate these receptors, and then that blocked the analgesia that the acupuncture was causing. So this is kind of an interesting way to look at it, because they know that the acupuncture was helping with the pain, and then they blocked the effects of the acupuncture, and that helps kind of suggest that there is an actual mechanism for the acupuncture, and it is the acupuncture and not some other factor that is creating the pain inhibition. So there was additional support for low-frequency protocols. The SLE 9-point showed that it prevented thermal and mechanical hyperalgesia in rats. And we'll go over these, and you'll be able to see the protocols in the table in just a minute. That same study showed that they were able to use some of these other doses to prolong anti-hyperalgesia, increase some of these anti-inflammatory markers, right? And it just shows that these studies actually did find positive effects, reducing hyperalgesia, that's the oversensitivity, decreasing cytokines that are pro-inflammatory, reducing some of the toxins in the body, reducing overall inflammation in the body as well, and some of these other systems as well, right? So now we're going to move on to the studies with the human participants. This is a great one, because this was a multi-center, randomized, assessor blinded controlled trial. So this is like the gold standard. This is what we want in clinical trials. Now, it wasn't a huge trial. I believe it was 126 participants with a healthy group and a group with neuropathy. They used mixed current stimulation, 2 Hertz and 120 Hertz. That way they're getting the effects of the low frequency and the high frequency. And they did 6 points bilaterally, so 12 points total, twice per week for 8 weeks. That's a pretty reasonable treatment protocol, I think, for most patients. And they found that it was effective at reducing pain, but also helping the sleep disturbance, so they weren't waking up as much at night with the burning pain. And there was no serious adverse effects, which is a lot better than what we can say for some of the other treatments with the drugs and some other things, right? Sometimes patients will get effects. So this is a great clinical trial, and we need to expand these and just make even larger ones, right? If we could get something like this in a group of 500 participants or 1,000 participants, we might be able to get scientific publications to take more notice and get this into generalized medicine. This was the other human study. It was a 2-week cross-sectional study, 96 participants, and they did it with Electro Acupuncture, the intermittent pneumatic compression, and they were able to show that it increased the sensory nerve conduction velocity in the common perineal nerve, and it was actually improved when they used both the Electro Acupuncture and the pneumatic compression, as opposed to just the B12 injections, the cyanocobalamin injections. So it showed the efficacy rate for both the acupuncture and the pneumatic compression was actually 91.7. So that obviously varies to different degrees between patient to patient. That's a fantastic success rate. You can't really beat that versus electro acupuncture alone. Still, significantly, statistically, it is significant clinically and for the IBC group alone. But you can see using combined, it's a lot better group, right? And then that's just the B12 injections, 37%, And it also found that they had lower serum concentrations of these different biomarkers, which are well established, showing these are things that kind of pop up in people with diabetes and that are having neuropathy. So we were able to track some biomarkers as well as their subjective feeling on the pain in this group. And this is what the IPC kind of looks like. This is a very cheap one. These you can get on Amazon for like $80. So this is definitely something that can be recommended to patients and can be used at home in addition to the treatments we're doing, right? And they go up to $1,000 or higher, depending how cool you want to look, I guess. And the efficacy of them, I'm sure. So here's the first table. So this is the animal studies. We started off with the publication, the different symptoms and how they induce the diabetes, the protocols of the dosage that was used, the different frequencies that were used, the acupoints that were used, and then the outcomes, the different biomarkers that were actually effective, right? And those were the ones we just reviewed. This is the second page of the animal studies. So you see some of the different points, and I summarized all this at the end. And here's the human studies. These are the 2 human studies. So they started off with the history of them, the dosage, once again the frequency, the different points, the outcomes, the amount of participants in the groups, and what type of controls they have, what type of control groups. So as far as the discussion goes, it looks like electro acupuncture actually offers very beneficial effects for both animals and human models, very positive outcomes. It raises the pain threshold and improves neurotransmission, nerve signaling between the nerves that become damaged. It reduces blood sugar levels, plasma glucose, it reduces inflammation, it reduces cell death, and although there was only 2 human studies, the quality of the research was pretty good, and it was well tolerated, right? No adverse effects on any of the patients. So reviewing all these studies, it's pretty clear that the acupuncture works. However, there are some limitations to these studies. The protocols are all different, so we can't really do a systematic, like a meta-analysis, because the frequencies are all over the place, the amount of acupuncture points used are all over the place. Some points were, some studies were just 1 point, they only did just like stomach 36 on the rats, and other studies had 12 points. And once again, there's only 2 human groups, so, and those had different protocols as well. So we need to standardize that, and that's kind of what we're getting to next. So these are the different frequencies and the points used in the studies. So how we broke this down, and I think I want to thank Dr. Foodie for helping me kind of go into the next level of this. At first I just did the research, and Dr. Foodie was like, well, what are you contributing to this? What's your contribution to the field? Besides just, hey, it works, which is great, but that doesn't really give us anything to move forward with or help with standardizing any of this. So out of all the studies, I kind of went and looked at what points were used the most. And I listed their TCM actions and how they affect the different pathologies within TCM. So stomach 36 was used, Zusammenlegung was used in 11 out of 12 studies. So almost every time. And then we listed the different frequencies. What are the most common frequencies? And you can see the frequencies are all over the map with that as well. Spleen 6, Sanya Jiao, was used in 4 of 12 studies. And the frequencies. And then all 3 of spleen 9, liver 3, Taichung, and Shenshu, bladder 23, were used in 2 of the 12 studies. So all the other points that were used were only used in 1 study or less, so I excluded them from my table and from my proposed protocol. All right, and we got some figures here. This is the length of the sessions. So out of all the studies, 50% of them or more were 30 minutes or longer, was the treatment time. And the duration of the treatment, 34% of them or more was, it looks like more than 3 weeks, or 3 weeks. Well, you see we got 3 weeks here, and more than 3 weeks. So it looks like the longer the treatment goes on for, the better outcomes you're gonna have based on this. Although the other tests were positive, I was looking at what was the most common and what showed the best efficacy, and that's what we came up with our protocol in a minute. And here's the frequency. So by looking at the different frequencies used, you can see 2 hertz was in like 75% of the clinical trials. So I figured that's going to be the most effective. And then we have over 100, right? 100 was probably used, I don't know, 30, 40% of them had rates of high frequency as well. So here's the meat and potatoes. This is the sum of all my research. This is a protocol that we're proposing. We're going to use these 5 points, right? Stomach 36, spleen 6, spleen 9, and liver 3, bladder 23. This is different than the original protocol that I came up with prior to starting the program, because my initial research, or my initial concept was to do it based on local nerve anatomy. But having all this clinical research that already exists, and know that I'm not going to be doing my own clinical trials yet, this makes a lot more sense. And we can justify using this kind of stuff because we have all this research to back it up. So we're going to alternate the frequencies between 2 and 120 hertz. And one of the human studies, the same thing that they use as well. Length of sessions should be at least 30 minutes, done daily for 3 weeks. So 21 sessions over a 3-week period. And we can expect the outcome to show, based on all the research, that it is going to reduce the pain, it is going to reduce the hypersensitivity, and it is going to improve neurotransmission and nerve signaling as well. So this is a protocol, and it's going to easily be done in a prone position, right? Mostly leg points. We treat people for these points all the time, prone, right? Liver 3, you just lift the foot a little bit, you have access to the back, spleen 9, stomach 36, you can access from the sides, no problem. So the conclusion after everything is that both preclinical and actual clinical studies suggest that electro acupuncture significantly alleviates pain by these following mechanisms. It reduces inflammation, regulates inflammation, it reduces and regulates pre-programmed cell death, it modulates and improves nerve signaling and transmission, it improves the circulation and even reduces blood sugar levels, which we know is part of the problem, right? And while both the protocols and the points differ, it appears that most of the studies were successful and it will alleviate pain. So more research does need to be done, just so we can confirm these in larger scale trials and be able to move forward to the next step of advancing our field. Right? And this is just the table of captions and figures, and that's in the caption as well. And that is the end. Thank you.